You might be surprised to know that 90% of patients have been found to ask their doctor about CBD. And many patients are asking the questions about what is CBD? Will CBD help me? And is CBD safe? And those are the topics that I'm going to discuss in today's video. Hello and welcome back. I'm Rosen, and thanks again for tuning in. If you haven't already, please subscribe. And if you could, please take a moment and click the thumbs up like button so people like you find content like this. So in today's video, we're going to talk about CBD. Now, a lot of my older patients sometimes want to bring this up, or I sometimes bring it up, and they'll lean in and say, "Isn't that the stuff that gets you high?" And that's the big misperception. So most people, when they think of CBD, they might be thinking marijuana and they're thinking of Cheech and Chong. But there are two main plants out there. There's marijuana plants and CBD plants. And marijuana plants contain THC, which is the psychoactive component that gets you high. And it also contains some CBD. On the other hand, hemp plants produce predominantly CBD with very little to no THC. So you get the medicinal properties without getting high. And is this helpful or important in my world? Well, yes, because patients that have arthritis have pain, and patients after knee replacement and other surgeries have pain, they have inflammation, there's an anxiety component, many patients have difficulty sleeping, and CBD has the potential to actually influence all of those circles. Now, there was one study that I know of in the total knee replacement world a few years back that looked at just topical CBD, and they did not find that there was any statistical difference in patients' post-operative pain. My personal experience has been that patients that had CBD added to a multimodal pain management regimen had less pain. So a few years ago, before we in our group had a standardized workflow for multimodal pain management, I was sort of the tinkerer. And one of the things that I added to my approach was CBD in a number of my patients. And what you can see here is my pain score was 1.7, lower than the average of our group at the 12-week mark. So my experience was that my patients did better when they added this to acetaminophen and anti-inflammatories, nerve pills, nerve blocks, and cold therapy. The question is, should you use it? So you have to understand, many patients are already using it. 20% of US adults are using CBD. When I questioned my patients for a period of time, it was actually 50%. The problem is that about half of the products on the market only contain within 10% of what's stated as to what the CBD content is. And a lot of products that have been studied on the market contain heavy metals and fungus and mold, so they contain contaminants. So the product that I've been recommending to my patients for a number of years is by a company called Corganics. They're based out of Texas, and the owners, Chad and Reggie, actually reached out to me during COVID, and we had a number of really interesting conversations. And the thing that I thought was really great about the two of them and their company is that they were interested in educating physicians. So they actually have an online module that I took that taught me all about CBD and its history and the chemical compound. And then you actually have a test that you take at the end of it. They only sell their products through the recommendation of a healthcare provider. And the three big markets are plastic surgery, oncology, and orthopedics. And these are all patients, as you can imagine, that have to deal with pain and inflammation post-operatively. So from a product standpoint, I feel comfortable if my patients are interested in CBD and do not want to get high, that this is a THC-free compound. Not only is it derived from hemp, but they also do third-party testing, and they test for other contaminants. So it's as safe or as pure of a CBD product as you can get compared to a lot of the other products that are studied on the market. And what's interesting and what I learned is that we have this huge endocannabinoid system. So we actually have receptors for all of these compounds in the body already, specifically ones for inflammation. And this is where this product can actually help that. So patients always ask, and they should ask, is it safe? And my experience is I've not seen any of my patients have any significant side effects from using this. The most common one reported in the literature is nausea, which is a pretty common side effect that you'll hear with just about every medication. The other thing that is concerned, or there's concern for, is it can affect liver metabolism in a particular thing called cytochrome P450. So I tell my patients, like, if you're on a blood thinner, it can make your blood a little thinner, but if you have a pill that says do not take with grapefruit, then CBD should be combined sort of with grapefruit idea, in the sense that don't take your blood pressure medicine with grapefruit juice, don't take your blood pressure medicine with the CBD. Take it at a different time of the day so there's not as much of a risk of the two of them interacting. Now, the big question is it proven to be better? And this is what I would like to know, and we might find out in the near future. So there's one study that I know of that's going on in New York, and they basically have three groups: a control group, one group that is getting 1 pill a day, another group that is getting 2 pills a day, and I believe there's another study going on at University of Michigan. So the hopes would be that in the near future, we actually have data to show or suggest whether or not this is helpful and how much help patients get from adding CBD into their multimodal postoperative pain regimen. So if it's something that you've been considering using, I hope this answers those questions. If your doctor's not aware of it, what I would recommend is that you talk to them about this company, and they can reach out to the company where they can then learn more about CBD and its potential benefits. So as always, thanks again for watching. Until next time, stay safe.